This is Men's Health Awareness Month, and Father's Day, of course, is coming up this weekend. 7's on your side, focusing in on the health of the men in our lives. And this morning, we're joined by Dr. Roy Joseph, a urologist with Holy Cross Hospital. He's discussing men's sexual health. Good morning to you, Dr. Joseph. So good you could join us.
Good morning, Melanie.
Good morning. So what would you say is the most important aspect of men's sexual health, and why is it something that many men overlook?
So one of the main features is that it's a difficult conversation to have, both with your partner and with your doctor, and it's vitally important to be able to get help with other issues that could be causing it. So the first is the stigma, and it's important to talk to your primary care physician and to your urologist about symptoms that you may be having. And the key is that by going through the diagnosis and treatment, we may uncover cardiovascular disease, diabetes, hypertension, things that men may not even realize that they have. And in getting treatment, they also help their partner who suffers equally through that. And both people may not want to talk to each other, let alone to a physician about it. And it's just to get out and see your physician every year.
So important. So let's talk about those symptoms. What should men be mindful of when changes start to occur? I mean, are there certain signs that they should be looking out for?
There are, and because it's multifactorial, 1 out of 10 men sometime in their life, whether you're young or old, will have trouble with sexual health. And when it happens, it can be caused by stress, anxiety, depression, but also the other factors that I mentioned. So if you have a problem and you have difficulty with intimacy, even 1 or 2 times, if it's persistent and it's lasting for more than a few weeks, then you should bring it up to your physician. Performance anxiety is another issue. So once you have trouble at any age, it can be a vicious cycle where the psychological aspects overcome the potential organic problem. But if you have trouble and it's affecting your relationship, then it's important to bring up.
So how can men then best take care of themselves, and talk about how often they should be consulting with their physician?
So it's a lot of the common, usual things of not smoking is important, limiting alcohol, exercise is helpful. All the things that we would normally say are just healthy habits anyway, those also would help with sexual health. The frequency of being evaluated would be annually with your primary care physician, where you have both a PSA, which is a prostate-specific antigen, it's a blood test to screen for prostate cancer, and a digital rectal exam for all men ages 40 to 70, that's vital. And if your primary care physician then goes down the path of needing a urologist, then referrals are made to us and then we help with that.
All right, very important talk that every man needs to be having with their doctor. Thank you so much for joining us, Dr. Roy Joseph with Holy Cross Hospital.
Thank you for having me.
All right, coming up.